Are we in order just now?
Yes, that's all right. Call the meeting to order and just welcome everyone to the Finance and Property Committee of the Board of Health meeting. And before I proceed, I'd like to do the land acknowledgement and take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850 and that we are all treaty people. This land is the traditional territory of the Anishinaabe people and is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis' historical presence in this region. I encourage everyone to think about how they may contribute to the process of reconciliation. And the first order of business for the Finance and Property meeting is the election of the chairperson. And we haven't received any nominations electronically, so I'll open it up to the floor and online for any nominations. Eric?
I'd like to nominate Mary Ann Stickland.
Mary Ann, do you accept the nomination?
Only if there's no one else that's willing to do it. I would nominate anybody that would want to do it, for sure. Kathy, Dave, Aaron, anybody?
No.
I'm not seeing any takers. Take a quick look online. I don't see any other nominations.
You've done such a great job.
Thank you so much, Mary Ann, for letting us.
Thank you for volunteering.
It's moved by Rick Champagne, seconded.
I'll second that.
Dave. So be it resolved that Mary Ann Stickland be elected chairperson of the Finance and Property Committee for the North Bay Parry Sound District Health Unit for the year 2020. We'll have the vote. So Rick Champagne,
Yes.
Karen Cook,
Yes.
Blair Flowers.
Yes.
Thank you. Sarah Inch is absent. Jamie Lowry is also not attending. Odie?
Oh, sorry. No one.
Jamie McGarvey,
Yes.
Jamie Restwell,
Yes.
Marianne Stickland.
Mhm.
Chris is also absent. Dave Wolf,
Yes.
Tim Shepard,
Yes.
and Catherine Still.
Yes.
All right, carried.
Thank you, Mary.
Thank you, Mary Ann.
It is my pleasure,
And with that, I'll pass it over to you.
but only for one more year. Well, you had a little sheet with people who weren't here. Okay, so we've done that. Okay, so we're moving right along. We're going to do the election of a vice chair. Do we have any nominations?
I can nominate Jamie McGarvey.
Would you like your name to stand, Jamie?
Under the same format as you, if nobody else is interested.
I saw somebody's hands go up. Jamie Restuel, did you want to nominate someone? No?
I'd second the nomination.
Okay,
Move close of nomination.
okay. It's Jamie McGarvey. And it was moved by Rick, correct?
Yep.
And seconded by Jamie. Okay, so be it resolved that Jamie McGarvey be elected vice chairperson for the Finance and Property Committee for the North Bay Parry Sound District Health Unit for the year 2024. Any further discussion? Hot topic, I know. Rick,
Yes.
Karen,
Yes.
Blair,
Yes.
Sarah Inch is away. Jamie Lowry's away. Jamie McGarvey,
Sure.
right on, thank you. Jamie Restuel,
Yes.
myself, yes. Morris is away. Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
The motion is carried. Thank you.
Thank you, Jamie.
We will make a dynamic duo for the next year, right? Right on.
To do it.
Okay. Moving on to the next item. It is the approval of the agenda that has been presented for today's meeting. I am looking for someone to move.
I'll move.
And a seconder, Kathy? Be it resolved that the Finance and Property Committee agenda dated March the 6th, 2024 be approved. Any additions? Any further comment? Nope. Moving on to a recorded vote. Rick,
Yes.
Karen,
Yes.
Blair,
Yes.
Tim,
Yes.
Jamie McGarvey,
Yes.
Jamie Restuel,
Yes.
myself, yes. Dave Wolf,
Yes.
Catherine Still.
Yes.
Motion is carried. Does anyone have any conflict of interest to declare at this moment in time? If you do, then just let us know as we move along if you do find that there something. So moving right along to a really exciting presentation by our audit report. I'm not sure if there's any comments that Dr. Zimbalati or Isabel would like to make before, or would you like to wait until after the presentation?
Derek can.
Okay, so Derek, I give you the floor to move us through this item on the agenda. Welcome.
Thank you very much. It's one of the first times I've heard an audit planning report being described as exciting, so that's quite positive, I guess. I guess I'll share my screen if that's okay, just to make it easier to follow along. Okay, so thank you. I'm going to go over the audit planning report, and this is just a standard report for those who were here last year. It's again a similar content will be covered, just updated for current year events. So as last year, I will still be your lead audit partner, and Sarah Lingenfelter will be our senior manager on the engagement again. So looking at some of the audit highlights, and some of these things, again, are relevant, and I'll go over in a little bit more detail in subsequent slides, so I'll kind of quickly go over them. Materiality is set for the engagement, and I have a whole slide on that. It is set at $685,000, and I'll go through how that was calculated on a subsequent slide. Some updates to the audit plan. Again, as everybody knows, there were some discussions about mergers, and again, we'll have to just deal with the impacts of any of those discussions in the course of the audit and any potential disclosures that may be required in the financial statements. But again, we'll work with management on how to deal with that appropriately. Also looking at the risk of management override of controls. That's a standard risk part of any audit that needs to be addressed, and I have a slide to cover that. And as well, there's a presumed risk of fraudulent revenue recognition. Again, this is a standard risk in any audit that's completed. And again, we have to do certain procedures to potentially mitigate that risk. So nothing unusual, nothing really significant, standard audit procedures that would be done as part of any audit. Is the size of the screen okay, or would you like me to make it any larger, or is that okay as it is?
You could make it a bit larger. I think that would be helpful. Thank you.
So as mentioned, materiality. Materiality is an audit concept, and materiality is set at the beginning of the audit. And it's a numeric concept, but it's also based on both qualitative and quantitative factors. And again, we assess initial materiality based on using either prior year numbers or current year numbers, depending what we have most accurately set. So again, we would set an initial materiality, but we also evaluate materiality throughout the course of the audit to make sure that our audit procedures are being performed at the appropriate precision level. And then at the end of the audit, we do a review of materiality to ensure that our initial assessments were not too high. So looking again, as I mentioned, materiality this year is set at $685,000. That's up slightly from last year when it was $678,000. And we can use three measures to set materiality from a numeric perspective. We can use total revenues, we can use total expenses, or we can use total assets. And we do a cross review of all those numbers to make sure that if one of the metrics is completely out of line, we would not consider it as part of our materiality calculation. So in this situation, we're going to base our materiality based on total expenses. And we're also ensuring that we remove any expenses from the prior year that would have been one-time funding or one-time expense items. So looking at the balances, we can see here we're basing materiality on approximately $22.9 million of expenses. And if we take 3% of that number, that's how we end up getting up to the $685,000. When we do a cross review of revenues were $24.6 million, so higher, which means if we would have selected revenues, we could actually increase our materiality, but we're very comfortable using expenses as our base for our materiality calculations. And finally, Total assets is similar again at $23.5 million. So, but we're going to go with expenses that we used last year as well. And as a measure, we're comfortable. Now, you may ask, how does the 3% come about? We are, from the professional standards, we can select anywhere between 1% and 3% of expenses or revenues as our base for our materiality calculation. And the determination of whether we're going to pick 1%, 2%, or 3% or anywhere in between is depending on the level of internal controls that the entity would have and the quality of the financial information that is given to us. So we've selected at the high range at 3% because we feel that the health unit has a very strong system of internal controls and the quality of financial information that is presented to us as the auditors is high. So we've gone at the high range of our materiality calculations. So materiality really is just a base to determine what audit procedures we're going to perform on what financial statement line items and streams. That's not what we call an evaluation materiality. That is set at a lower number. And if there's any questions, please, you can just ask me at the time or I'll answer them at the end, whatever's most convenient for you. So some updates again, just looking at certain things that will impact the current year audit. There is a new audit standard, accounting standard that will impact the current year's audit and financial statements, and that's for PS 3280 on asset retirement obligations. So this is a new standard, which can be quite complex, which requires a lot of professional judgment and not necessarily all on the auditors, because a lot of it's determined on things like asbestos and capital recoveries and things like that. You know, based on our understanding of the health unit, we're not anticipating this to be a big change for the health unit. But we will work with management to go through our ARO checklists to make sure that there's no capital assets that we would determine that may have an ARO impact to the financial statements. But again, based on our initial understanding, we're not expecting this standard to have a significant impact on the financial statements for the health unit. Again, as mentioned, we do look at risks as part of our audit. Some of the main ones, again, we look at the management override of controls, and then some of the other items, the main items that we're going to look at, again, splitting between risk of fraud and risk of error. So we're going to look at these items as listed, and I've got kind of a base of what audit procedures will do for each of those on subsequent slides. So as mentioned, one of the significant risks is the potential for the management override of controls. And we consider this what's called a non-rebuttable risk of a material misstatement. Non-rebuttable in the sense that we have to do something to address it as part of the audit. We can't just ignore it or explain it away. And the reason is that management, because of their understanding of the accounting system and how internal controls work, may have the potential to override controls that may otherwise appear to be operating effectively. Again, this is a risk present in any entity. It's just the level of risk varies depending on the internal controls that you do have in place. So as part of this, how we deal with this risk is we would look at certain things such as the testing of journal entries and other adjustments, specifically ones close to year end, where you're where the biggest risk of trying to achieve a certain financial target or book an adjustment that may or may not be required in the financial statements could take place. We also look at what's called a retrospective review of estimates. So if there was an estimate that was booked in, say, the 22 financial year, we would look back at the 22 number. We would look at what actually happened in fiscal 23 to make sure that management's process for recording estimates is accurate. So again, we're looking back to say if management said that a certain estimate was, just picking a number, $100,000, we would again look to see if that number was valid in 2023. If management's process and that number was accurate, then we would understand that management's process for determining estimates was a good process and solid process, and therefore have more faith in any estimates that were in the 2023 financial statements. And finally, what we do also is we again look for the business rationale for any significant unusual transactions that are recorded in the financial statements. So again, we'll be looking for source documents and management's explanations of why certain transactions may be booked. Standard procedures, again, nothing unusual. This is what we do to deal with this risk in the audit. So again, one of the other risks I mentioned was the risk of fraudulent revenue recognition. This is a rebuttable risk because we can do a lot of procedures to deal with this risk. And what we do here is looking at the analysis just to highlight a lot of your operating revenues are easily confirmed and can be traced back to agreements. So, that portion of your revenues, which is a significant portion of your revenues, is quite straightforward to audit from that perspective because it's just agreeing to agreements and remittances. Municipality funding is also very easy to audit because it can be confirmed with the municipalities. And then we also look at certain program funding, looking at the deferrals and certain funding agreements. Again, all going back to original agreements to make sure that the revenues are being recorded appropriately and in the appropriate period. We would also look at the number of individuals in the process for recording revenue and make an assessment of how that process works. And we believe that the organization has sophisticated processes and department staffing, which can ensure a sufficient segregation of duties to reduce this risk. We also look at things like the third-party expectations for net income. There are no third-party expectations for net income that we've identified and there's no loans that have any covenants tied to having a certain net income or excess of revenue over expense number. And there's no external funder requiring that the organization attain any specific net income number. Therefore, again, lowering the risk of any fraudulent revenue recognition. And finally, the organization is we don't consider this a high-profile public entity in the sense that it's not on any exchanges or anything like that. And again, there's no significant third-party expectation with regards to revenue or net income, which would create any pressures or incentives to perhaps manipulate the financial results. And finally, no bonuses or profit-sharing incentives are tied into revenue or net income in any way. So these are all the procedures that we take into account when we're rebutting the risk for revenue recognition. So again, some of the other bigger areas where there's the potential for the risk of material misstatement, again, government grants. I kind of already went over that. Is again, we look at the year-end reconciliations for closing grant balances, looking at the supporting documentation for significant items. If necessary, we'll confirm certain documentation. And we also do analytical procedures to ensure that revenues and payables and deferrals are appropriate as recorded. Looking at payroll, which would be one of your larger expenses, we're going to perform what we call substantive tested details over salaries and benefits, including the accruals, and ensure that the amounts are properly allocated to the departments. And we'll recalculate significant accruals and review collective agreements for the completeness of any liabilities related to payroll liabilities. Tangible capital assets. Again, we'll vouch significant additions and disposals to the supporting documentation. We'll also perform a review of your repair and maintenance expenses to ensure that they've been accounted for properly. We'll review the existence of capital asset schedules with capital assets inventory that's maintained by management. We'll perform analytical audit procedures to ensure the accuracy of the amortization of tangible capital assets that's reported. And we'll also do inquiries of management if there's any impairment of any tangible capital assets, and if so, have they been appropriately recorded in the financial statements. And finally, as mentioned, we'll look at the asset retirement obligations. And here we're just going to be looking for the completeness of management's review of the assets and their assessment of any potential remediation that may be required under the standard. And we'll ensure that all the related disclosures related to AROs are included in your financial statements. So some of the key milestones and deliverables. So in January, we would had a January, early February, had a kickoff meeting with management to discuss the audit, get the timing and the planning done. This again would involve risk assessments and updating our understanding of the organization. In February, we would do our risk assessment and interim work, doing process walkthroughs. If we could, we would do interim data extraction to get ready for the year end. And we do our interim testing and testing over system controls. And then March, April, we'll do our year-end data extraction and process activities, do all the remaining substantive audit procedures, review financial statement disclosures, present the results to Finance and Property Committee, and we would be then in a position with management's agreement, be able to issue our audit report on the financial statements. Our independence, again, our fees are based on our response to the RFP that was issued by the City of North Bay. So our fees based on our response for 2023, the audit was $23,700. The audit of the ARR was $2,640. And again, we also have, through conversations with management, some additional services that may or may not be required this year. So we've basically had some ideas on what it's going to cost. There is the adoption of the new CAS standard, which is CAS 315. That is, again, a standard that is based, it's not a KPMG standard, it's a Canadian audit standard that has to be adopted. And our experience has been that's about 5 to 10% of the base audit fee to do the enhanced risk assessments. There's also the audit of the Healthy Baby, Healthy Children program, and that is going to be based on hours incurred. Because the first year audit, it's hard to determine, but we've given management our best estimate of what those fees would be. We also asked to talk about or to give an idea of the cost incurred with the testing of the conversion of the accounting system as they move from one accounting system to another. So we've discussed that with management and given them our best estimate at this time. And again, the adoption of the PSAS standard is going to be based on hours incurred. You know, we'll keep management informed as we're going through the process to give them an idea of where we're going to be with that. It's really difficult to give you an assessment of where that will be until we have a complete asset listing and have a look. And again, it varies at every entity as well. So very, very challenging to give you a specific estimate there. But we'll keep management informed and have discussions with them as we go through that work. So some of the appendices, I'm not going to go through these in any detail. Again, our engagement letter was signed last year, and a full copy can be, management does have a copy available and can be distributed upon request. And really here again, audit quality, we just want to reiterate that you know, audit quality is the number one thing that we are committed to as part of our process. We have a system of quality management that's aligned with ISQM1, which is an international standard and part of the Code of Ethics for Professional Accountants that we have to make sure that we follow. So we follow all the rules of ISQM1. And again, we define audit quality as that audits are executed consistently in line with the requirements and intent of applicable professional standards within a strong system of quality management, and that our activities are undertaken with the utmost level of objectivity, independence, ethics, and integrity. There are some new changes to accounting standards that will be potentially applicable to future years. But my proposal is that I'm going to review these with management and yourselves when I do the audit findings report a little bit later on, and then we'll have more time to talk about the potential impact to the health unit. And again, if you do want to see what's going on in the audit and accounting world, there's all these links that are available to you to see what's going on. And as specifically as Property and Finance Committee, there's guides that are available to responsibilities for audit committee members and things like that. We also have a climate change financial reporting resource center that's available because it's a hot topic, not necessarily for entities like the health unit at this point. It's more still at the public company level, but those reporting changes are coming. We see it in the IFRS world, that they are being pushed down to other entities as well. And that's all I have for the audit planning report. And again, if there's questions, more than happy to do my best to answer them for you.
Thank you, Derek. Does anyone in the room have any questions? Anyone online? So I'd like to take this opportunity to thank Isabella and her staff for all her hard work, as always, in getting the audit underway. And thank you very much, Derek, for presenting to us today.
My pleasure. My pleasure. Have a great balance of your meeting.
Thank you.
Thanks, Derek.
Okay, so moving on to 6.0, approval of the previous minutes. I'm looking for someone to move, approve. Jamie McGarvey and a seconder, Rick. Be it resolved that the minutes for the Finance and Property Committee meeting held on November the 29th, 2023. November the 9th, 2020, right, 2023, be approved as presented. Are there any errors or omissions noted by anyone? Nope. Okay, we'll move to recorded vote. Rick?
Yep.
Aaron? Blair?
Yes.
Tim?
Yes.
Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Myself, yes. Dave Wolf?
Yes.
Catherine Still?
Yes.
The motion is carried. So then we have the date of the next meeting set for April the 24th, 24. Time and location to be determined. I see that we have no business arising at this time. So we'll move on to new business. 9.1, the fourth quarter income statements to December 31st, 2023. And those are all included in our package. Not sure, well, I guess you would like to speak to those. They're
I'll just say that these are the preliminary unaudited. We'll bring in the audit report and the statements will be back in the April meeting. If anyone has any questions about what's been presented, I'll try to answer them. The same format we've been using for a few years now. So,
anyone have any questions on the fourth quarter income statements in the room or online? Seeing none, move on to 9.2. The fourth quarter medical officer of health expenses, September 1st to December 31st, 2023. I think those are pretty self-explanatory. I'm not sure, Isabella, if you have anything further to add. Any questions from anyone in the room or online? Nope. Okie dokie, we have no in-camera. So at this time, we will adjourn the Property and Finance Committee meeting and turn it over to our board chair, Rick, for the next part of our show.
Thank you very much and congratulations, Mary Ann. The great work you've done and allow yourself to stand for one more year. Well, thank you. On to our part of our agenda is going to be fairly quick. We're going to be going camera, so that'll be the biggest part of our meeting. So let's get it started. We're going to call the meeting to order, so I need approval of the agenda. Need a mover and a seconder, please. Jamie McGarvey and Tim Shepherd. It be resolved that the Board of Health agenda dated March 6, 2024 be approved. Favor Rick Champagne, yes. Karen Cook,
Yes.
Blair Flower,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Marianne Sticklin,
Yes.
Morris Switzer, oh, sorry, he's not in. Dave Wolf,
Yes.
Tim Shepherd,
Yes.
Catherine Still.
Yes.
Thank you. Just for the record, Jamie Laurie,
Gotcha.
Switzer and Sarah Inch are not with us tonight. They have other commitments. Thank you. Motion carried. Conflict of interest. If you see something, if something comes up, please let me know. We'll note it. Approval of the previous minutes, March 6th. Need a mover and a seconder, please. Marianne. Karen Cook. It be resolved that the minutes from the Board of Health meeting held on January 24th, 24 be approved as presented. Vote Rick Champagne, yes. Karen Cook,
Yes.
Blair Flower,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Marianne Sticklin,
Yes.
Morris Switzer. Oh, I did it again. Dave Wolf,
Yes.
Catherine Still.
Yes.
Thank you. Carried. 4.2, Board of Health in help minutes in camera on January 24th, 24. Need a mover and a seconder. Catherine Still.
Yep.
Dave Wolf. Be resolved that the in-camera minutes from the Board of Health meeting held on January 24, 2024 be approved as presented. Rick Champagne, yes. Karen Cook,
Yes.
Blair Flower,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Marianne Sticklin,
Yes.
Dave Wolf,
Yes.
Tim Shepherd,
Yes.
Catherine Still.
Yes.
Carried. Date of the next meeting, April 24th, 2024. It's going to be in your packages and lines. Business arising. Don't see anything there.
It's just I report back from attending the Alpha Symposium in the middle of February.
Yep.
Sure. So it was February 14th through 16th. The 14th was a full day with different presentations identifying numerous climate change related resources. And for me, the highlighted messages of all of those sessions was the importance of taking a climate in all approach to planning and policy. As public health advocates for health and all, this is a climate and all. And the second real take is the importance of considering health equity in all climate change related plans. And of course, that is a key tenet within public health. On Thursday, there was just a seminar on thriving in change. So this was a workshop which focused on embracing preserving stability. And then the Alpha Symposium proper took place on Friday. Two particular presentations, which I found were particularly good. One was from the CAO for the County of Frontenac, who has been in his role through a number of mergers in the public sector and presented on lessons learned. And it was an excellent session. And then there was the second presentation by Sabine Matheson, who's a political analyst, and they placed the current interest in voluntary mergers from the Ministry of Health within the context of the current provincial political environment. and provided some useful insights into working with the Ministry of Health at this time. So that was another valuable presentation. Additionally, I thought you might be interested in the presentation by Public Health Ontario. They were introducing us to their new strategic plan. However, at that session, there were questions related to changes that were highlighted in the Auditor General report, namely the planned closure of several public health labs, as well as the planned divestment from performing well water testing. The outcome of these questions, which weren't directly related to the presentation, was that there was going to be further engagement between Public Health Ontario and the public health field to better understand that and plan around the consequences of these changes. Now, these changes haven't been approved by government yet, but they are before Cabinet.
Any questions for Patty? Go ahead, Jamie.
All right, just keep us updated on the well testing part of it. It is extremely important. I think we all come from areas that have a lot of wells, and it is a very important service. That would be appreciated.
It is, and I think it's something that does disproportionately affect the North. So we had good representation from the North at the meeting with PHO.
Good.
Any other questions for Dr. Zimbalati? No, I see none. Okay, thank you for the report, Dr. Zimbalati. New business 10.1, corporate sponsorship and donation 2023 report to the board.
The report of the Maglo.
Oh, sorry, Doc. Oh, there you go.
He's open, yeah.
That's all.
Nice.
Here.
I'm trying to get on to our people waiting. Sorry, Dr. Zimbalati.
Yeah, so the report is included in your package. However, given the week's delay and the fact that the report gets written, for approvals like earlier on, there's actually a couple of updates I'd like to provide you. The most important one, I think, is on measles. This is something that I'm sure you've been hearing about in the news. And so far in Ontario, there have been 5 measles cases reported in 2024. One of the new cases had no known travel or contact with an infected individual. And these 5 cases are in addition to numerous other cases across the country, particularly in Montreal, Quebec, that they're seeing quite a few cases there. The increase is concerning, and global declines in vaccine coverage are implicated. And, measles is extremely transmissible. So for every infected individual, they can infect another 12 to 18 individuals in an unvaccinated population. And this is compared to about 1 to 2 for COVID. So it's probably one of the most transmissible infectious diseases that is out there. And it's associated with some very severe outcomes and hospitalization, requiring hospitalization. So pneumonia, encephalitis, and death. It's also been known to cause immune amnesia, so wiping out previously acquired either vaccine or illness-derived immunity. Fortunately, the vaccine is very effective. It's about 97% effective. But because measles is so transmissible, you need at least 95% of the population to be vaccinated to really be able to block outbreaks. So in response to these emerging cases, we've taken a number of steps. We've been doing a lot of messaging, both on social media to healthcare providers to encourage them to be vaccinating and encouraging vaccination themselves. messaging going out through schools, especially to those who don't have complete immunization records. And we've been stepping up availability of our vaccine clinics, especially leading up to and over the March break. Additionally, we're conducting some preparedness exercises so that we can make sure that we're ready to respond to a local case or a local outbreak. And we did, to change topics slightly, we did receive a question from the MOH report from someone who couldn't attend today. So I thought I'd just share the question and response with everyone. And it was regarding the percentage of high-risk food premises in our catchment area. Morris Switzer highlighted that he saw that 15% of our food premises were rated as high risk, and wondering if that was a concern. So whether a food premise is rated high risk or not is dependent on a number of factors, which includes the population that they serve, the clientele they serve. So if it's in a daycare or a hospital, then its risk rating is higher. And also relates to the type of food that is sold. Is it all prepackaged versus requiring a lot of preparation? But also factors in terms of the facility's history go into the risk assessment as well. So while a risk rating, high risk rating does cause more work for our public health inspectors because it requires more inspections, re-inspections. There isn't really a good way to compare our proportion of high risk food premises compared to the rest of the province. We do know in the recent comparison we did with Renfrew that our rates were about similar.
Any questions for Dr. Zimbalati? Just one question. You're talking about, we have enough vaccine, obviously, for the measles if there was an outbreak, obviously, right?
So that is part of the preparedness exercises, ensuring that we do have enough stock, and it does appear for now, and the province is doing the same thing. They're assessing their stocks and ensuring that they can order more if need be, because we do anticipate there's going to probably be a global demand, increased demand for vaccine as well. We're looking at stocks of immune globulin, which we don't order. Those are ordered through the hospital, but ensuring locally we have access, as well as the province has sufficient stocks of the immune globulin, which is provided in certain cases when someone's been exposed.
No, thank you very much. Anybody else have a question? Go ahead, Dave.
One quick one. You said there are currently 5 cases in the province of Ontario. March break is coming. Do we know what the case counts are in places like Florida, for example?
Yeah, I don't know. I don't have numbers there, but any travel is a risk, particularly if you're going through high congregated areas like airports. There's the risks associated with those kind of mass gathering places as well.
Do we know what the case numbers are in British Columbia?
Like the Quebec.
A lot of people are going to go skiing, and a lot of people are going to go south. So
yeah, a couple of reported cases. I are one of the provinces that has reported cases in 2020.
How long after one has been in contact do they start to present?
So the prodrome of the flu-like illness occurs on average about 10 days after exposure. And then the rash on average is about 14 days after exposure, with a range of about 7 to 21 days.
So exposure leaving from Pearson and coming back from Vancouver is within a reasonable time to infect an entire plane load of individuals.
So the period of infectivity is between 4 days before and 4 days after the rash appears.
Okay.
So yeah, there's a, a period of time there where you can be completely asymptomatic or be symptomatic with very general but non-specific symptoms. So definitely that's another reason why measles is so concerning.
And is Public Health Ontario looking at some sort of screening for people that are coming back into the country or coming from other places when they arrive at an international port of call?
Not at this time.
Thanks.
Karen?
I was just wondering, what is our catchment area? What is our immunization rate? There's a lot about that in the news as well, about lower immunization rates in different areas. I was just wondering what ours was.
It's actually really hard to know because there isn't a registry.
Oh,
Right.
okay.
We do know we have data on school-age children.
Right.
So at the primary school level and secondary school level, but those aren't like to the minute numbers. Those are from I think 2022 that we have the most recent numbers on those. The vaccination rates generally among the 12 to 16 are pretty good. They're in the range of 95%. It's the younger population that were more impacted by COVID in terms of remaining on schedule, where we're seeing that immunization rates are lower. And in terms of adult population, we don't have a good sense. It would be fantastic to know, for instance, teachers, because that the schools tend to be an area where infections are transmitted. So it'd be great to be able to have that sort of information, but we just don't have a good way to collect it.
Just a final comment. So as far as contact tracing, if something does happen in our health unit, we've got a guideline that we follow for.
Certainly, there's a protocol within the Ontario Public Health Standards and an appendix, which is actually currently being updated to reflect the kind of new reality. So that should be available soon. But yes, it's very prescribed how case and contact management.
Thank you very much, Dr. Zimbalati, sorry for jumping over the top of the conversation we're having. All right. 8.0, board committee report. Correspondence in your packages. New business 10.1, corporate sponsorship and donation 2023 report to the board.
For information.
Information only, okay. Any questions? No. 10.2, request for proposal 2023 report to the board. Again, nothing. Memo, governance, documentation changes.
Right, so we did bring forward to this Board of Health, last spring?
In September.
The changes that we are planning for related to Board of Health bylaws and moving those bylaws into 3 different documents. So a code of conduct for Board of Health, the Board of Health governance manual, which was previously known as the orientation manual, and it's the third document, bylaws. Yeah, into our bylaws. So that work is now complete in terms of drafting those documents. So we'll be bringing that forward to the April meeting.
Thank you. Any questions?
Those 3 documents require our approval.
So the bylaws certainly require approval. And then, really it's your code of conduct. So it really should be approved by the board. The orientation manual is more for information purposes.
Okay, thank you.
Okay. No questions online? No, we're. Okay,
After reading it, you can submit questions before the meeting if you'd like.
10.4, meeting schedule 2024, revised version. It's in front of you. I need a mover and a seconder. Moved by Dave Wolf. Second by, oh, sorry on wave, Jamie Restool.
Yep.
Sorry, Jamie. Okay, moved by Dave Wolf, second by Jamie Restool. Whereas in accordance with the Board of Health bylaws, section 218, the Board of Health approved the regular meeting schedule for the year 2024 and January 24 board meetings and subsequently revised at the same Board of Health meeting. And whereas a revision for previous approved Board of Health meeting schedule were required as follows. So they're on there for March, April, June, September, November, December, and January 25. I've recorded a vote. Rick Champagne, yes. Karen Cook,
Yes.
Blair Flower,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Mary Ann Stickland,
Yes.
Dave Wolf,
Yes.
Tim Shepherd,
Yes.
Catherine Still.
Yes.
Carried.
On that, we probably will need at least special meeting in March, possibly two, related to the intent to merge. So those can be approved at the time of those meetings. But we can discuss that.
Okay. We're up to item 11. We need a mover and a seconder to go into camera. Moved by Catherine Still. And by Jamie McGarvey. It be resolved that the Board of Health move into camera at 55. Discuss agenda on item 11, a position, plan, procedure, criteria, or instruction to be applied to the negotiation carried out on behalf of the board. Need a mover, Rick Champagne, or sorry, vote Rick Champagne, Karen Cook,
Yes.
Blair Flower,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Mary Ann Stickland, Dave Wolf,
Yes.
Tim Shepherd,
Yes.
Catherine Still.
Yes.
Remind everybody to not to say anything until we're offline.
really.
I know.
Name, Jamie.
It's the Jamie thing.
The Jamie Club.
There is one this time.
Moved by Mary Ann and a second by Jamie Harvey. It'll be resolved that the Board of Health rise and report at 7:17 PM. All in favor? Rick Champagne, yes. Blair Flower,
Yes.
Karen Cook,
Yes.
Jamie McGarvey,
Yes.
Jeremy Restool,
Yes.
Mary Ann Stickland,
Yes.
Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
Carried. Thank you very much for coming out tonight. Very important meeting and thank you for being here.
You're welcome.
Thank you.
You done?
Yes, it shows up. Was it?
Have a good night.
Good night, everybody.
Good night.